Welcome back to the Virtual Resiliency Project. I'm Sarah Schulman and I'm here with Ramona Smith. And today we're starting a new series, about different holistic practices, because really what the Resiliency Project was doing at the Brigham and Women's Hospital was introducing people to holistic practices, including Reiki and orthobionomy. We had practitioners coming in and offering the staff these treatments, and so they could have a one-on-one experience with these treatments. And so while we're doing virtual, we're going to be introducing all sorts of treatments for you to understand how they might help you in whatever you are struggling with. So today, for the first one, we are inviting Ramona Smith, who is a nurse practitioner trained in Western medicine, but also trained in a lot of holistic practices, including Theta Healing. And Theta Healing, I'm going to have her tell us all about it, but I urge you, if it interests you at all, to seek out either her or a practitioner, because I was the lucky recipient of a appointment with her earlier this week, and it was incredible. So I welcome you all, and thank you so much, Ramona, for teaching us about Theta Healing.
You're welcome. It's one of my passions, actually. I was first introduced to Theta Healing working in a practice with many different modalities: acupuncture, therapy, energy work, and Theta healers. And I referred one of my clients to one of the Theta healers, and she had an incredible relief of chronic neck pain she'd had since she was a young child. And I thought, well, I might want to check out what this actually is before I recommend, a lot. And I went to a session and it was amazing, like you had described. And I went on to get my basic training and then on to advanced, and then doing also work with children, particularly in the area of autism, spectrum, things like that. So Theta Healing is best described as a technique that focuses on thought and prayer, and it teaches us how to use our natural intuition to heal ourselves. And we were talking about how we have this primal desire, and we're also equipped to heal ourselves from within. And we just have to tap into that and learn lots of different ways to utilize that. And it relies on unconditional love coming from creator of all that is what Vienna refers to it. It's not a religion. All religions are accepted. It's more of a spiritual connection with this incredible power that can actually heal and help us. So I found that it was helpful both in treating patients with physical conditions like ankle sprains that just wouldn't heal, or chronic abdominal pain that all the testing couldn't figure out what was going on. What we realized is there was a lot of emotional energy that was stuck. And there's other practitioners that really work with that stuck energy as well. The key that really brought me a lot to Theta is the fact it's a positive lifestyle change. It doesn't, you don't have to go to 52 weeks of therapy to figure out why something happened. What you do is you get to the root of what was that emotion that locked that. So that's a long description of it, but an example was just that we have a belief that we're not good enough, or that we'll never be good enough no matter what we do. We don't know where the belief comes from. It could be coming through in our DNA. It could be misunderstood early messages, or maybe intentional messages that we weren't enough. And so if we can dig down deep enough to find that root and pull it out and replace it with the fact that we are enough. Some of the basic beliefs are so simple, but when they're skewed, we fall into ill health. And this is one of the tools in the toolbox to help release that and to get some healing.
So who would benefit from? I know a little bit about the founder because I was curious about it after getting a session and read a little bit, and I know that she cured herself of cancer. Is that accurate?
I've never met her. I received the training through Rochelle Stanley, who's a master teacher. I took the classes in Santa Cruz. I can't speak for her story, but I've
Yeah.
seen some amazing instant healing. And I believe we should ask for instant healing. We should just expect that that's going to happen. And I've seen one particular woman who had a chronic ankle problem, and they kept x-raying it and doing all these things, and they couldn't find the problem. And I think we had 2 sessions, and her foot healed. How is that possible? I don't understand it always, but I'm witnessing the healing. It's the creator of all that is. It's the energy of whatever you want to call it, Allah, Mohammed, God, Lord, or just creator. The person who created us, that energy is there to help us heal. So my practice is more along the lines of emotional health, depression, anxiety, even schizophrenia and bipolar. There's a lot of interesting, that's a whole topic in itself of working with what are some of the reasons behind those emotions. And often anxiety comes at a time when the person doesn't even know where it's coming from. And that's what we dig in, and we pull that root, and then that person can go on and feel safe again, and feel protected, and feel powerful again. So
And so can you tell us a little bit about what a session would be like?
well, a session with me might be different from another theta healer, basing that on their background and experience. I've been a nurse practitioner for quite a while, so I bring into that the sort of, we call it medical intuition as well, which you of course have as a physician. All of us as healthcare workers use it whether we realize it or not. So I come from the aspect of first getting permission from the person to be healed. Sometimes something's holding us back, and that healing is actually giving a secondary gain. So we have to kind of look at, do we want a healing of this and what that might look like? It depends on what the person comes in with. If they come in with an emotional, I'm going to look at it a different way. If they come in with physical, and sometimes we come in with both. We can't really separate those out. An average session is an hour to an hour and a half. And as we go through the session, if there's a belief that needs to be shifted into the positive from a very negative and harmful belief, we always ask the client for their permission to do the change. At any time, you can say no. And I think that that's a very respectful and ethical system that we work for with healing. Often in hospital settings, as you know, sometimes the things we need to do, the people really don't want it, but they really need it. And so sometimes their choice is not as appreciated. With theta healing, the client always gets to choose. If they're not ready to let go of something, then we talk about what does it mean to keep it and what does it mean to let it go. So every session for me has been, and I've been doing theta healing for about 7 years now, everyone is unique because every person is unique. So I hope that helps describe it a little.
And so if someone were interested in getting a theta session, so it sounds to me like it can, it's, you tend to use it in emotional settings, depression, anxiety, autism, mental health, but it sounds to me like it can go the gamut. So, my intention with this interviewing is that why not try, that's how I've been able to heal myself is, trying everything, and oh no, that's not for me, but this one is for me, and we're all so different, and so it sounds to me like anybody could benefit from this, and any health issue.
Any age. This may sound wild, and my Western medicine head kind of goes, really? I've even worked with pregnant women, working on connection between a mother and her newborn. As we know, it's a very energetic, it's a very symbiotic kind of a relationship that happens during a pregnancy. And sometimes things happen where someone really wants to clear something before they give birth. So it can happen in utero. It can go, I think my oldest patient, was 86 and had some chronic shingles. And we were able to work on it in a way that I was even amazed that Creator could do it. And the way she described it to me, the client, is she said, I feel tingling where all I've ever felt before was pain. And she could feel the coolness and she could feel it lift. I sat in the room with her. These can be done remote. It can be done on a phone call or like we're doing.
Yeah.
And I wasn't touching her. She was sitting in front of me, but she had the most amazing lifting of her face. The pain of shingles I've never had it, but I've seen the pain in the eyes of the people that do. And you could see that anguish and that intense concentration it takes not to feel that pain lifted from her. So I would say, whatever it is, try it. Whatever physical or emotional or even a spiritual struggle we might have, it can release a lot of things and let you move forward.
Yeah, I mean, I loved my session, and I'm benefiting, like, noticing things and wondering, was that part of this? Or so if someone were to want to try and find a Theta Healer practitioner, well, I mean, they can always contact you, right? We'll have
They
to put
can, absolutely.
you will put your
My information
with this video. But is there like a Theta Healing place where like practitioners are, organized?
listed, yes.
Listed, yeah.
So there is a website, thetahealing.com, and you can go on it. It explains it more. So people like yourself, you can decide, is this something for me or not? You can also look under practitioners, and you can put in the name of a practitioner and get their information, or you can put in your location. Say you live in, Los Angeles. You can you'll see quite a few in there. Now, unfortunately for me, I have a last name of Smith and a first name of Ramona. So I'm the second to the last if somebody searches in Santa Cruz, California. There's no preferential. You can't pay more to get higher up in the list. But what I would encourage people to do is, if they look at that list of providers and they click on it, it'll say what areas they've got the training in. So mine would say, for example, I've been trained in advanced and basic and working with what we call rainbow children, which are children with special insight and special, they're sort of visionaries that are coming in that need support. People like I was a rainbow child. I was a child who came into this world with gifts, and I was fortunate enough to have ancestors that guided me, and that was really helpful. So you can look and see what each person has been trained in. I would caution using someone who hasn't registered with them, because that shows they finished the class and they're actually certified. So that would be a great way to get a good recommendation. And you could call the person, ask for, if someone called me and said, hey, I'm not sure about this, but I'm interested. I usually do a 20-minute consultation with them. What are you looking for? What have you tried? Something like that. So most providers, if they're professional, would offer that free consultation so you can decide, because we're consumers. We get to pick the very best for us.
Awesome. Well, so thank you so much. I love the idea of putting all this out there, because there's so many amazing ways to heal other than Western medicine, especially for these chronic, issues. And I urge everyone to try. I mean, I've been so amazed to see friends of mine with metastatic cancer completely healed by these holistic practices, and people with depression and anxiety. And I mean, the amount of amazing techniques and tools out there is amazing. And so part of the intention of this series is to just try and introduce people to that. So thank you so much for coming and being with us, Ramona.
You're very welcome. You're very welcome.
We'll see you next week for some more information.
Sounds great. Thank you so much.
Tuning in.